scar combination treatment. We've already done some subcision. We've already done Bellafill. You guys went live, right, for Pixel?
Yes, we did.
We did
Niche of the
Pixel,
PA.
with Niche of the PA, the microneedling radio frequency. And now we're doing our deep FX over the marked areas of the deep scars that we've already put some filler into, that we've already done subcision on. But now we are going deeper with the laser. And this laser, the deep part of this laser is much thinner. So you don't get a lot of bleeding, but you get a lot of swelling. And this will allow us to get more lifting for the scars and get more softening of the scars more quickly. The negative to this is those that have lighter skin tones will be redder longer. And those that have darker skin tones, you can't do this on because they'll cause severe hyperpigmentation. So you could do this only in a select group. So in this case, we're definitely able to do this for her. She's light enough skin tone. She has the broad atrophic scars that are lifted with filler. And we're gonna be doing a combination of lasers. So this is a no-brainer. Let's get her more improvement. We actually did the exact same treatment on a patient last night. And he's recovering today. He didn't let us show you the video, but he agreed to the pictures today, right, Jordan?
Yes, he did.
So we're going to be following him and her, showing basically the same
You're
treatment.
asking about kojic acid soap?
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 Well, I don't know about the soap, but kojic acid is a great product post-treatment. It helps prevent hyperpigmentation, and it's used in our pre- and post-procedural protocols. We're also going to be doing her temple area. And you guys can see if you zoom in really up close, take a look. There are little dots there, I promise, in the skin.
You guys can see them. They can see them on the screen now.
These literally, I'll show you in a second, are cutting little holes 0.12 millimeters into the skin, which are going very deep.
People are saying they need this, Dr. Emer. Guys, send us a DM, full name, email, phone number. Our team is going to reach out to you. Is it good for whitening dark spots?
No, well, yes, it depends if the dark spots are sun damage.
People are asking about some of the CO2 question mark. Yes, guys, we're using our CO2 laser, our Ultra Pulse, and this is our Deep FX handpiece. After this, we're going to switch to our active for our patient. They want to know about the recovery post-treatment.
Well, we have a whole post-procedural protocol at emeragecosmetics.com that you guys can go and get. Full skincare regimen that she's going to be on. Let me just take a look. Just take a look really quickly. We pretty much did what we needed to do for the deep part. Now we're going to go to the superficial part. So while they're changing, I'm going to wipe her.
Should we introduce her with?
What?
Should we introduce
Not yet. Not yet. We will.
Can this also whiten your skin?
Yes. If you have a lot of sun damage or sunspots, you can get a lot of improvement with that. What we're going to do right now is focus on texture. And even though this will improve sun damage, she's young. She doesn't have a lot of sun damage. The point is she wants scar improvement. So we're going to work to get her scars improved.
Julia's on here.
And get her as much improvement as we can. She's doing really well. This is literally the last step. The first step was our filler, our Bellafill. Our second step was our subcision. Our third step was our microneedling radio frequency. And now our fourth last step is to combine the two lasers, the deep and active, with PRP for healing. Perfect. So show them the skin, show them how it looks.
You guys can see all those marks right there, all the circles. That's where we did our Deep FX laser. That's also where some of her deeper scars were that we placed Bellafill to help raise them up so they're not as depressed. And we are subcision to help break the bands of scar to help the Bellafill set in nicely.
Now we're not going to go light. She's young.
She can handle it.
One, she can handle it, and two, her skin can. She's younger with more oil, and the hair follicles have more stem cells because she hasn't had a lot of sun damage or treatment. So she can handle a much higher density, 80 to 90% fractional. Got it? All right. Hold on. Over. Move that pedal a second or the cord. Yeah. There you go. Okay. All right, do a test spot. Hold on. We're gonna do this test spot right now. Good, you guys can see, look at the scanning, it's creating holes even in there. So what do you think it's doing into the face? So you guys will be able to see, we're starting on the chin. And we're resurfacing. Now this is a little more painful, so we're gonna make sure that she's doing okay. This area, again, 1.2 to 1.3 millimeter in depth, or in surface area. So more pain because there's more heat being delivered at every little spot. There's also a higher level of fractional. And so we're definitely doing a big treatment here today. Not only did she do the deep laser, we combined it with the microneedling radio frequency, and now the superficial laser. So we're getting the best we can in one treatment. You have to be super cautious not to damage the skin. In the old days, we used to do extreme fully ablative laser and cause whitening and hypopigmentation to patients. We also used to cause delayed healing, sometimes redness up to 6 months in those that were doing those types of treatments. So we try and limit that now and do a maximum 6 weeks of redness and get them back to doing about 6-8 weeks of non-ablative laser. I'll show you guys in a second. We'll turn her in 1 second. She's doing phenomenal. What are they saying there?
Lots of people are actually joining on right now. They love our CO2. And guys, today we're going to be doing tons of lasers, different cases for each one. Up next, we're going to do our halo for our patient that had that really bad accident from a microchannel roller.
Oh,
we're going to be doing some laser to help him out.
Oh no, that's terrible. Do we have pictures of that?
We do on our Instagram. We'll have them ready when we go live.
Wow. So with her, we're doing a little bit more dense over the areas where she has deeper scars. I already previously marked those. And also it looks a little different here in this area because we did the deep laser. There's a lot of tissue swelling there, so the CO2 doesn't look the same.
If you want to know what is this, must be some new people on here. This is our CO2 laser right now. We're doing a laser resurfacing to the skin. We're going to help resurface the skin, soften acne scars. Right before this, we did our Deep FX handpiece. And now we are doing our active.
More there.
People are asking, what is this again? We just answered that. People are not speaking English. We're happy to have you.
We'd love to have you. I just don't know if I can answer you. Where are they from?
I don't know.
You don't know. That's okay. Well, we're going to continue the process, doing this deeper laser. And some people have commented before about me going into the hairline. It's very important actually to do that because you don't want to create a line in front of the hairline. Yes, it will burn potentially a little bit of the hairs, but they grow back. And it's very small. It's not something noticeable.
It's not laser hair removal, but if you do want that, we offer it as well.
Yes, exactly. Those don't grow back when you do that.
How is this girl not even moving? I did CO2 a couple times and tears are just rolling down my face.
She has a high tolerance for pain. She's very motivated. So it's a lot of mental preparation. And we did nerve blocks and pills. How are you feeling? Are you okay?
Yeah, I'm fine.
You're doing really good. You're like amazing. Everyone's in awe by you right now. You're halfway done too with this part, which is the more painful part. Everything else is easy after this. What are you hoping for? You just want as clear as you can get, right?
Yeah.
Why did you want to do a big treatment first?
Why?
Yeah.
I feel like I don't see like the most treatment.
Just the most you could get in one treatment.
Yeah.
All right, hold still a second. I'm going to go around your mouth.
Can you do a laser to remove a small burn on the arm?
Yeah, of course.
Come
We'd
see
have
us,
to see
guys.
it. In the old days when I used to work with burn patients, we used to do a lot for scars and burns, and we used to do a lot for movement. Like, let's say you have a scar that's holding your arm in a position. You can use lasers to break apart the scars, like a keloid. All right?
We have other doctors on here.
So we are working our magic here, just trying to be thorough. She's doing really well, like I said. This is painful, but she's doing great. And again, this is not an anti-aging thing for her. This is a confidence booster because we're improving scars. She's younger. which allows her skin to heal better actually from the lasers.
People are telling her how nice she's gonna look in a few days.
Turn your head. They're very excited for her, which I love. I love you guys. Thank you so much for caring about our clients. And we do this because we want you to be educated. Very few doctors do live videos like this, showing the reality of a procedure. Procedures aren't great, you know, looking. They're aggressive. But that's how you get the results, right?
It is.
Okay.
Lots of people writing in. I wish I could read what they're saying.
We need a Google. We need an Instagram translator.
We do.
I know. I wonder what Siri would say if it was just repeating it to you. How it would repeat it.
You're asking, what is this, please? We have like 300 people on here now.
Great.
They want to know what this is,
Turn
guys.
to the right a little bit.
This is our CO2 laser. Right now we're doing a laser resurfacing for our patient to help soften her acne scars. We did our deep CO2 laser before this, and we did our subcision to break the scars loose, some Bellafill to raise them up, and our pixel.
And given that she's a lighter skin tone, she's going to heal much better from the laser with the aftercare.
Is it possible to do CO2 with a couple active pimples?
Yes.
Always, guys. We've done it plenty of times.
No problem. Love
They
to.
want to know if we can wipe that off for a second. I don't know what you're talking
What about
about.
the acne? Yes, we can treat your acne beforehand. This is where she had that scar before.
While we're getting to the end, can we talk to them about what she's going to be used afterwards for
Yeah, I mean,
post-care? Talk to the
a big
products.
component, you guys, is the aftercare. And then a few weeks from now, preventing hyperpigmentation or prolonged redness. So using an LED light like a Dermabeam or Light Stim is really important. Following the skincare protocol with the Emer Skin, Pila B, AFP, and Refit Base. Stem cells, okay? Using stem cells from anti-age serum. And moisturizing with my refit-based peptides, as well as Sente-Dermal Repair. And then one of the biggest components, one of the most important things is exfoliation. As the skin is peeling, you don't want to occlude it. You don't want to use an aquaphor. You don't want anything that's going to push in heat or keep the skin non-exfoliating. It's very important for new skin to be lifted off. So we use enzyme polish, like my enzyme polish, or the Tamburini Cleanzyme. All right, we're going to start on her forehead now. And the enzyme, the Cleanzyme in my enzyme polish, you guys, has papaya enzyme and mixed acids, and they are very gentle.
So let's see, where in Florida are we located? Guys, we're in Boca Raton. We'll be there this month now. Actually, it's the first of the month.
Oh my God.
It's coming up very soon, guys. Send us a DM, full name, email, phone number. Those pop-ups fill up so quick.
We were just in New York and did a ton of lives. Jordan, how does everyone look?
Everyone's looking great now. Everyone that did the lasers is starting to peel right now, so we have a lot of great things to show you.
Oh yeah, I'm super excited actually about our darker skin client that did a ton of TCA spots.
He just texted me today. He sent me some follow-up.
I can't wait to show because he was so excited to tell everybody.
He's really excited about his treatment plan. He texted me today. He's like, can't wait for the next one.
2 different people from where he works already wrote our Instagram saying, I saw he works there, I want to come in. So they actually came in because of where he works. So you see we got feather into the hairline, very important. Just feathering. All right, this area is a little more sensitive. I'm just letting her know. We're gonna get her through this. This is the last part of it, a little more sensitive. Do a little more overlap here as well because you can see she has some central scars here in the mid forehead. So I wanna get a little more heat here. So we get a little more collagen production. All right, let me turn you to the right a little bit. Beautiful. And this is not good, you guys, if you have melasma. You don't want to do that. Darker skin tones need to be treated very lightly if this is done. And with prep, you know, you guys are, someone was commenting today on my Instagram, how are you treating someone so dark? It's years of experience and understanding how to do the skin and expecting the outcomes.
What is this laser called? This is our CO2 laser. This is our luminous ultra pulse.
Exactly. We're using the CPG scanner right now, Active FX. almost done. She's basically at the
Is
end.
it painful for our patient?
How do you feel?
I feel fine.
She's doing really good, you guys. I mean, bionic, basically. That's what she is. And it's going to be, and you know what? I have a feeling my patients that have very minimal pain, they also peel and heal really fast. So I'm super excited to see how her healing process. So I have a feeling she's going to do really well despite us having such a strong treatment protocol for her. But she's prepared. She's got everything. She knows what to do. We have our full protocol. And if those that cannot come to us but want to do this treatment, you can do it in New York with us or in Boca. Or you can do a free skincare consult. Yeah, or come here. Or do a free skincare consult with us online. And we'll send you what you need to prep and do treatment. I'm going to do her nose really quickly. Let's get those pores. Not that she has many scars here, but, you know, some people have a little ice pick on their nose. I'm going to turn here.
Wow, a lot of people on.
How many?
A lot of people on here.
Good. Then we're going to introduce the doctor at the end. More people. That's why. Okay, so we're finishing up doing all the areas, being very thorough. That's why we have our amazing goggles here. And from Innovative Optics, if you guys are trying to find any goggles, I'm just being really thorough here. In terms of all areas being treated. Now I'm just going to take a quick look, make sure everything is complete. The edge of her chin. Okay, everything looks really good there. Perfect. Okay. Okay. So now we're going to add. Now we're going to do a little bit of healing. And while we're grabbing that, Jordan, why don't you introduce our new surgeon?
All right, let's have you introduce yourself, Dr. Sanan.
Good afternoon. Good morning. Good afternoon.
Depending on where they are.
Depends on where you are. Yes, that's right. So he's our new facial plastic surgeon, you guys. We're going to be showing you some amazing results of what he does. He can tell you really quickly, but he's an amazing rhinoplasty surgeon, amazing surgeon of all facial surgeries. So you guys will see some amazing combinations very soon with me and him. You can say a little bit afterwards.
Dr. Sanan.
A little PRP.
Let's do PRP.
This is going to go right onto the skin to help her heal. I don't want to push too hard because I don't want the scabs to come off. We did a lot of clinical trials years ago showing that it's very important to actually keep the wounds intact rather than debriding, which is what we used to do in the old days where we would peel. You only do that with rhinophyma when someone has a
Does this cause some type of skin cancer?
No, this actually gets rid of skin cancer. This prevents the risk of skin cancer. So you guys can see we're putting on our healing protocol. She's going to use Emer skin and all of our follow-up stuff. I'm going to take this off, and then that's it. And then you guys can say hi to Dr. Sanan.
Let's ask her how she is really quick. Can our patient tell us?
How did you do for treatment?
Good. It wasn't too bad, honestly, for pain.
Excellent. And we just hope to get you a really good result.
Yeah,
So that was really it. You just introduce
All right, we
him
got like
one
800
more
people.
time.
Let's introduce him. All right, doctor, tell us about what you do.
Hey everyone, Dr. Sanan, nice to meet you all. Can't wait to see you here. I'm a facial plastic surgeon. Specialize in cosmetic rhinoplasty, functional rhinoplasty, revision rhinoplasty, deep length facelift, neck lifts, upper lower blepharoplasty, lip lifts, buccal fat removal, the whole gamut of cosmetic facial surgery and non-invasive, so Botox, fillers, radio frequency microneedling, non-surgical face and neck lifting. So we can't wait to meet you all, and just be showing my before and afters and my collaborations with Dr. Emer.
All right, guys, you'll see lots more of him. Here's our patient right now. We just applied some topical products to help her heal. We're going to follow up with her in the coming days. You guys will see her on stories, and we can't wait for her to get better. All right, thank you for joining us. that.